Hi, welcome from Miami to our next talk. I'm Dr. D.Graybill. These series of talks are based and correlate with a book I've written recently entitled A Proactive Approach to Knee Replacement. There are a number of videos on this channel covering some select topics in the book. The book is available on Amazon Kindle. It's on Apple. It's on Barnes & Noble and published by BookBaby, also available there. The electronic version is available now. This is early November. The print version, I believe, will be available in December. This is the second talk in the series covering post-operative topics. I have a number of talks already posted on preoperative topics. This one is on the principle of early achievement of good range of motion of the knee leads to the quickest recovery. That has been my experience as a patient and my experience on my patients. I've done somewhere between 4,000 or 5,000 knee replacements in my career. And the patients that achieved early range of motion had a much easier recovery, ended up with better range of motion overall, and generally were happier. And my analogy here is the tortoise and the hare, the classic story. And I do believe that indeed the tortoise does better, because if we try to push things like activity too early, that interferes with pain control and achieving range of motion, leads to more swelling and a more difficult recovery. So we need to balance our activity level so that we're not interrupting the other parts of recovery. Pain control and range of motion and swelling being the other key factors that we want to do well early. I would point out that people can gain strength and activity at any point post-operatively. So if you want to get stronger 6 months after surgery, there's no block to doing that. However, range of motion is something that if it isn't achieved by 3 months, you make almost no changes after that point. And in fact, the first 6 weeks really are another milestone. And the third one is the first 2 weeks. So I would focus on motion very aggressively in the first 2 weeks and fairly aggressively during the first 6 weeks. It is probably the number one priority during all that time. And if you get good range of motion, pain and swelling usually will respond well. So we'll move onwards on this gradually, but that's a summary. Again, this pairs well with my book. I encourage you to use that as a corollary to these talks. So, again, kind of as I expressed on the first slide, the enemy of great early range of motion is too much standing, dependency, and walking. Dependency means the knee is below the heart level. So sitting in a chair, the knee is still dependent. People don't quite get that. Elevation means the knee is above the heart level, which isn't something we achieve by laying on a couch flat or sitting in a chair. If we spend too much time with the leg dependent early on, the leg will swell. If we get more swelling, motion becomes more difficult and pain also increases. So I'll reemphasize, your enemy here is trying to push activities too early. And what we really want to have is a nice balance where we don't get too swollen and too much pain to interfere with gaining the range of motion. So moving on, who are our friends? Our friends early in surgery are ice. You cannot ice too much. Ice shouldn't be applied directly to the skin, but if you have a dressing or a very light pair of slacks or something like that, or even just a cloth, ice can be applied. It can be applied 23 plus hours a day. And I would encourage ice all the time. So I've been through this. I used an ice machine all night. I chose a compression ice machine, which I think is great. It tends to squeeze the surgical site gradually from lower down to above the knee to kind of push fluid out. Ice reduces swelling. It's great for pain. Ice, I can't recommend too highly. Elevation, same thing. All night long, I elevated the knee. I made sure it was above the heart level. And I did this several times a day. If I had a little more pain or more swelling, I stopped what I was doing. I laid down. I elevated the knee. I applied ice. And thirdly, we have compression wraps. We'll discuss these a little later, but basically, if you wrap something compressive, which could be an ACE wrap or something called a TED, that's capital T-E-D hose, the one above the knee, to the leg, it'll tend to apply compression to the lower leg, which tends to swell. So this will oppose dependency. So if you wrap your leg after it's been elevated, then when we're up, it will minimize swelling. Again, very, very important. Ice, elevation, and compression. So another component here is the timing. Okay, I emphasized this kind of in the first talk. We're going to go a little bit more into detail here. The earlier you get your range of motion, good, and I'm going to define that as 0, which means straight, 120 degrees, which means past a right angle by another 30 degrees, which is a good amount of flexion. The quicker you obtain that, the easier it is to obtain that, the easier it is to maintain that. If a patient will come into me at 2 weeks and say, well, it's just too painful. Well, it's going to be more painful at 2 weeks than it would have been at 1 week or 3 days. So within the first few days after surgery, we should be trying to get the knee well past 90 degrees. So the best way to sit is with the knee flexed well or the knee fully straight. And we do not want to spend time with the knee partially flexed, 30 to 40 degrees, etc. There are a series of videos also within the same site on exercises with a little video on demonstration of chair rise, elevation, getting range of motion, both sitting chair range of motion and standing range of motion exercises. I encourage you to look at those. Follow your therapist. There are many ways to accomplish this. There's no right or wrong technique, but the earlier the knee is comfortable beyond 90 degrees and comfortable straight, the better you're going to do. How do you get it to be more comfortable? Repetition. So right after surgery, it hurts to bend the knee 90 degrees. But if you bend the knee 90 degrees and you leave it there, it becomes more and more comfortable. Same thing towards what we call terminal extension, or lay term would be straight. If it's hard to get the knee straight and comfortable there, the more time you spend doing that, the easier it is. The earlier you spend time pushing the motion, the easier it is. Again, repetition by 3 months, mostly your range of motion is fixed. It's hard to change more than a few degrees, maybe 5 or 10 at the most. Most people don't change even that much. So range of motion is an early goal. It is the primary goal in the early part of recovery, coupled with pain control and swelling, because those will interact with your motion. Again, by 6 weeks, it's difficult to make large changes. You can still make some changes. So if you're at 110 degrees at 6 weeks, can you get 120 degrees by 3 months? Yes, you can. But it's much easier to get that 110 to 120 before 6 weeks. So I really encourage you, by a week, we should be well beyond 90 degrees of flexion and fully straight. And if you're not there by 2 weeks, you really have to redouble your efforts. So get the range of motion early. That is extremely important. And if you're struggling with that, you got to look at, am I being too active? Am I spending too much time sitting, standing, and walking? If we're sitting, always when we're sitting, we should be working on range of motion multiple times every hour when awake. So range of motion is the task. You probably should be spending 10 minutes, an hour on this every hour you're awake. You can't do too much. So if you want to be a happy patient, happiest patients get good range of motion early. Patients that achieve good range of motion in the first few weeks have the least amount of pain, the least amount of swelling, and they get back to normal activities quicker than someone that tries to do that increase in activities early. So the other patient that says, okay, I don't want to sit around. I want to push my activity. I'm going to stand and walk. I'm going to push how far I walk. Every day I'm going to walk farther and farther and farther, starting a few days after surgery. So that patient, most of the time, will have more pain, more swelling, and really struggle with range of motion. And let's say at 6 weeks, they're going to be well behind the tortoise that listened to this strategy of ice, elevation, range of motion being the emphasis of the early recovery. And then once you've got good range of motion, right? Once it's comfortable to bend the knee 90 degrees and have it fully straight, then you can go ahead and walk and progress your walking pretty rapidly. And you'll end up far ahead of the patient that pushed activities too early. Now, this doesn't mean we sit around, okay? We need to have enough activity. We need to be getting up and down from the chair. I recommend 3 times an hour when we're awake, but we're up for just a minute or 2 at a time. And then we're back down, icing and elevating, working on a range of motion. And then we're up again. So short little brief walks are critical, but no real length of time standing and walking in the early time period. That's my recommendation. That's what I did. I recovered very quickly after surgery. I had excellent pain control. I think, I knew all these tricks, having watched thousands and thousands of patients, but there's a little randomness in this too. So sometimes a patient will kind of fly through one knee, the other knee, they'll struggle more, but the focus still needs to be on range of motion, ice, elevation, and moderating activities early. And I would say early, really the first 2 weeks. And if you're really doing well at that point, then that's the time to kind of push our activities a little bit. But again, if you start to get more swollen, if you start to have more pain, if you lose range of motion at any point, you're doing too much. You need to back off. So listen to your body. So hopefully this is helpful to people. Again, I encourage you to pair this with my book and the other talks in this YouTube channel. I'm going to have one more talk posted about early recovery, and then one talk on a topic later on after recovery, and that'll kind of complete the series that we've got. I may add some later at some point, particularly if some people have some interests. So, in summary, optimal approach, balanced activity to minimize pain flares, swelling, and emphasize range of motion. And there's our tortoise winning the race. So be cognizant of this. Listen to your body. If you're struggling with range of motion early on, you need to do something about it then. Don't wait. Talk with your therapist, talk with your surgeon. Back off on activities, focus on range of motion, ice, and elevation. Every patient's different, okay? But the principles apply. Have a great day.